Welcome to this clinical walkthrough on a missed myocardial infarction case for UK MLA, brought to you by Mediate, your 24/7 practice partner. Having to apologize for a major clinical error is probably one of the toughest conversations you'll have as a doctor. So today, we're going to break it down into 5 clear phases. Sticking to this structure will give you the confidence and the control you need to handle this professionally. All right, let's get into it. How you start this consultation is absolutely critical. You need a calm, structured opening to establish trust and set the right tone for the difficult conversation that's about to happen. So here's a really solid way to open. You'll introduce yourself, check how they're feeling right now, and then clearly state why you're there. This approach sets a serious professional tone without causing immediate panic. Now, this is super important. Before you deliver any new information, you have to understand the patient's perspective first. This isn't about taking a full medical history. It's about a quick, focused check on what they already know and remember. Start with an open question like this one. It immediately tells you what their level of understanding is, and it helps you spot any gaps or misunderstandings you'll need to correct later. Make sure you listen carefully to what they say. After their first response, you need to get a little more specific. First, check on their current condition. Are they in any pain, any palpitations? Then you'll want to walk them back to that first A&E visit. Ask them what tests they remember, and crucially, what they were told was wrong with them. So what's the goal here? Well, this brief history-taking aligns your story with their story. By confirming their timeline and what they understand first, you're creating a shared foundation of facts before you drop the new, difficult information about the mistake. Okay, this is it. The most critical part of the consultation. You have to deliver this news in a structured and deliberate way. We use a clear 3-step process to make sure it's handled with compassion and professionalism. Here's the sequence you're going to follow. First, you fire a warning shot to prepare the patient. Second, you build a quick narrative of the events. And third, you deliver the disclosure directly and honestly. Let's break down each of these steps. The warning shot is just a short sentence that prepares the patient emotionally. Using a phrase like this signals that the conversation is about to get serious, and it gives them a moment to brace for bad news. Don't rush past this step. Next, you build the narrative. Using the information you just got from the patient, you'll briefly summarize their first visit to A&D. You'll talk about the tests they had and the initial diagnosis they were given. This shows them you've listened and that you're both on the same page. And then you disclose the information. You need to state it clearly, without any medical jargon, and you have to take ownership. It was missed. The most important thing to do after you say this is to stop talking, pause, give the patient silence and space to process what you've just told them. Getting that pause right, knowing how to handle that silence, it's tough, and it's something you really need to practice. You can practice this exact case right now and get objective feedback on mymediate.com. Okay, so let's talk about what to do after the patient reacts. As soon as the patient reacts, your role changes completely. You're not delivering news anymore. Now you're managing their emotional response and providing clear explanations. This phase is all about empathy and trying to rebuild that trust. You should have phrases like these ready to go. Acknowledge their feelings directly. I can see this is deeply upsetting. You need to validate their reaction and take full, unambiguous ownership of the mistake. Say, this was clearly a mistake on our part. Don't use any language that sounds defensive. When the patient is ready for an explanation, you give them one. Explain factually what went wrong. For example, the ECG changes weren't recognized, and the blood test result wasn't checked before discharge. Focus on the failures in the process, not on blaming any individuals. Now, you've got to be prepared for this question because it's a hard one. The patient is going to want to know if things could have been different. Your answer needs to be both honest and very precise. Here's the key distinction you have to make crystal clear. The mistake was in the diagnosis, not in what caused the heart attack. Explain that the heart attack had already happened when they got to the hospital. The mistake was not identifying it, not causing it. This is a vital clarification for them. After you've discussed the past error, you need to bring the focus back to the present and the future. Reassure the patient by pointing out that they are now on the correct treatment path, they're being monitored closely, and their progress is good. This provides a much-needed sense of safety and control. All right, let's talk about the end game. How do you wrap this up professionally? This part is all about explaining the hospital's official response and what support is available to the patient. This shows accountability. You need to tell the patient about these specific actions. Let them know the incident has been formally reported, that a senior consultant is going to investigate, and that the hospital is committed to being transparent. This shows them how seriously this is being taken. It's also really important to empower the patient. You need to offer them the Patient Advice and Liaison Service, or PALS. Explain that PALS is an independent service that's there to support them if they want to raise a formal concern or make a complaint. This gives them an official channel and a sense of agency. To finish, you'll circle right back to the apology, reinforce it one last time, thank the patient for their time and their patience, and then open the floor for any final questions. This makes sure they feel heard and supported right to the very end. Putting all these steps together is the key to getting through this incredibly difficult conversation. To really nail your approach, you can practice this exact case now on mymediate.com.